Gears, you had the president in Annandale, Virginia this afternoon to really drum up support for his health care plan.
But if he's going to be successful, the real people he needs to win over are a handful of moderate U.S. senators from both parties. One key to that is the cost. Many lawmakers are balking at what could be a $1 trillion price tag. But today, President Obama said that wouldn't be a problem.
I have made a commitment, because our deficit is a genuine problem, that whatever we do, we have to pay for. This can't add to our deficits. It's got to be deficit neutral over the next 10 years.
All right, so can he do it? And what compromises is he willing to make?
Peter Orszag is the White House budget director. He joins us now from the White House. And Peter, we're going to talk health care, but I got to ask you about something that just crossed the Bloomberg terminal. California Governor Arnold Schwarzenegger declaring a state of emergency for California over the budget impasse. I mean, is the White House, going to do anything here?
Well, we're very carefully monitoring the situation, not only in California, but in other states. As you know, in almost all states, in 46 states, it's the beginning of their fiscal years. Most dramatic issues involving California, but there are other states that are struggling.
Hey, Peter, we're hearing from people that this is a train wreck, that California is really the big catastrophic situation, and they don't tend to mention other states in the same sentence. It's got to be a unique situation.
California is by far the most serious.
It's the 7th largest economy in the world?
I believe it is, and they've got a serious budget deficit. Is the federal government going to hand over money to make this go away, or are we going to see the state paying its workers in IOUs?
I guess what I will say is, don't forget that we did put, through the Recovery Act, a significant amount of funding into state governments, including into California. And beyond that, we are carefully monitoring the situation, ongoing discussions.
I got to also ask, it seems like every time we put a finger in this dike, another hole springs open. Is that a concern for you, that every time California seems to solve their crisis, another one pops up?
There's no question, and again, even though the problems are much more severe in California, states as a whole are struggling with the severity of the downturn and the severity of the downturn in their revenue base in particular.
All right, we're going to switch gears, Peter, because we did bring you on to talk about health care. I mean, the president's, will the president, I guess I should start, is, support a health care plan that isn't deficit neutral? Everybody's worried about the cost and how we're going to pay for it. So would the president do that?
I think we've been very clear this legislation must be deficit neutral over the next 10 years. It also can't have a big deficit hole at the end of that 10-year period. The president has been very clear. We've been very clear. So deficit neutrality is a must.
It looks like, Senator Mitch McConnell coming out and saying that the administration may pay for the overhaul in part by cuts to Medicare and to seniors. I'm assuming that's not the kind of rep that President Obama wants to get.
Well, let's actually separate those two things. We have put on the table about $600 billion in Medicare and Medicaid savings, including, for example, scaling back the degree of subsidies that are provided to Medicare Advantage plans, the private plans under Medicare. But a lot of times, and including in that example, we save $177 billion. When you save money for the Medicare program, you actually benefit, you actually help Medicare beneficiaries. In total, that $600 billion in savings for Medicare, because Part B premiums for Medicare beneficiaries are tied to overall Medicare costs, will save Medicare beneficiaries $43 billion over 10 years. So you need to be very clear to distinguish between Medicare providers and Medicare beneficiaries, not the same thing.
Peter, when it comes to the overall plan, there's a new poll out. It says basically 7 out of 10 Americans support the idea of a government-run health care plan. So they overwhelmingly like it, but only about 28% say that they actually want to use it. So does that mean in the end, after all of this, that it might not work?
Well, no, I think the whole point is we're trying to introduce another choice, expand choice, and reduce costs and premiums through that expanded competition and choice. And if folks decide that they would prefer not to opt for that approach or that public option, terrific. That's the way it should be.
Well, let me quickly ask you about the possible deficit results, possible results of this. America's health insurance plans, which obviously has, its foot in one camp here, says that current government plans underpay for services, and then those costs get passed through the healthcare system, and employers and consumers end up paying for that. Is that a problem that you've found a fix for? Because it seems to be the case in other countries.
Well, I'd say two things. First, there's certain forms of overpayment from the federal government that are just unwarranted and that we're not going to continue. I mentioned Medicare Advantage plans. All of the evidence suggests Medicare Advantage plans are paid 14% more per beneficiary than what it would cost to cover the same beneficiary under traditional Medicare. That just doesn't make any sense. In addition, though, as we cover more people, we are going to help folks who are already insured because we're going to reduce costs.
Thanks very much, Peter. Got to cut you off.